You see celebrities flashing perfect white smiles everywhere. But here's the truth, most of them aren't naturally white, they are chemically engineered. And before you grab that whitening toothpaste or DIY kit you saw online, pause. Because not every whitening product is actually whitening your teeth. Some might even be damaging them. Today, let's decode the real science behind that sparkling smile, what works, what's a waste, and what could secretly harm your enamel. Let's begin your smile glow up the safe way. Imagine two people. One spends 500 on a whitening toothpaste every month and another spends 15,000 once at a dentist. Both promise a Hollywood smile, but only one actually gets it. Let's find out who. So let's start with the basics. Why do our teeth even get discolored? Science says your enamel, the outer layer of your tooth, is naturally translucent. Underneath lies the dentine, which is yellowish. Over time, enamel thins out and picks up stains. Coffee, wine, tea, spicy foods, and even age can cause what we call extrinsic stains, that is, the surface level stains. While intrinsic stains come from within, like trauma, certain medications like tetracycline, or excess fluoride in childhood. So, whitening isn't one size fits all, and understanding the cause is step one. Now, here's where chemistry meets beauty. All whitening, whether at home or in the clinic, works by using peroxide compounds, usually hydrogen peroxide or carbamide peroxide. These release oxygen molecules that penetrate enamel and break down stain molecules into smaller, colorless ones. That's how your teeth look whiter, not painted but chemically cleaned from within. But remember, this reaction needs to be carefully controlled. Too strong and you risk tooth sensitivity or enamel erosion. Okay, let's break down the main types of whitening, from drugstore DIYs to high-end dental tech. Whitening toothpastes. These are great for mild surface stains. They use mild abrasives or enzyme-based cleaners but no actual bleaching. So, they make your teeth cleaner, not whiter. Think of it as a car wash, not a repaint. The pros are it's cheap, easy, and for everyday use. Whereas the cons includes minimal results, can cause abrasion if overused. Whitening strips and home kits. These use low concentrations of peroxide, usually 3 to 10%, and can give noticeable results in 2 to 3 weeks. But uneven contact is equal to uneven color, and if misused, you might end up with sensitive or patchy teeth. The pros include affordable and convenient. The cons include it's temporary and sometimes it gives uneven results. Professional in clinic whitening. This is the gold standard. Dentists use higher peroxide concentrations up to 35%, often activated by LED or laser light to speed up the reaction. One 45-minute session can make your teeth 6 to 8 shades lighter, and because it's supervised, it's much safer. The pros are it's fast, predictable, and safe, whereas the cons includes it's an expensive treatment and it can lead to temporary sensitivity. The latest tech, laser and zoom whitening. Laser whitening and brands like Zoom use photoactivation to supercharge the peroxide reaction. Results are instant and dramatic. The latest versions even use desensitizing gels and blue light tech to minimize discomfort. Science plus smiles is a big win-win. Now let's talk reality check. Whitening isn't magic and it's not for everyone. If you have cavities, worn enamel, gum disease, or dental restorations like crowns or veneers, whitening won't work evenly. And yes, sensitivity can happen. That sharp, stinging pain after whitening, that's the nerve endings reacting to temporary dehydration of enamel. Luckily, It's short-lived and can be reduced with fluoride gels or potassium nitrate toothpaste. How long does this last? That depends on your habits. If you're a coffee or a chai lover, maybe 6 months. If you're careful, up to 2 years. So think of whitening like a facial for your teeth. Maintenance is the key. And always follow up with touch-up sessions or custom trays made by your dentist. Some myths to be busted here. I can whiten my teeth with lemon and baking soda. Please don't. Acid plus abrasion is equal to enamel erosion. Charcoal toothpaste is natural. Natural? Yes. Safe? Not always. It's gritty and can wear enamel down. Once I whiten, it'll stay forever. Nope, your enamel will continue to pick up stains. So the truth, only professionally guided whitening gives lasting safe results. So here are the takeaway points. Get your teeth professionally cleaned first. It helps whitening agents work better. Avoid hot cold foods right after whitening. Your teeth are sensitive. Use a straw for staining drinks. And always use fluoride toothpaste to remineralize enamel. Whitening isn't vanity, it's confidence. Because when you smile, the world notices. So make sure it's not just bright, but healthy. If you learned something new today, hit that like button, subscribe, and share this with someone who's been dreaming of a whiter smile. And remember, the best kind of smile is the one that's authentically you. Thank you.